This week on the Communicators, our guest is Chris Schoeder, the CEO of HealthCentral Network. He'll discuss the increased use of technology in the healthcare industry and his experiences starting an internet-based company focused on healthcare.
Well, the Washington, D.C. area is home to several technology companies, and the Washingtonian magazine recently ran an article looking at some of the tech titans here in the Washington area, and Chris Schoeder was one of them. And this week he joins us on the Communicators. Chris Schoeder is CEO of HealthCentral Networks. HealthCentral.com is the website. Please give us a primer, Mr. Schoeder, on your business.
We formed HealthCentral.com just about 4 years ago with a very, very strong belief that there was a lot of confusion and a lot of noise online in terms of the way people are finding health experiences. And as you know, when you're wrestling something that could be an illness or even wanting to take charge of your life and want to think about your wellness, it can get very confusing and very scary. And for all intents and purposes, there were these great encyclopedias of health like WebMD, but we thought that there was a real opportunity with this technology to do two things. First, to create a collection of websites as opposed to one destination, disease by disease and condition by condition, wellness issue by wellness issue. Because at the end of the day, we're not just a health entity. We're wrestling what we're wrestling. We're thinking about what we're thinking about. So it's important that you have an experience that really is about you and your circumstances and what you're thinking about. But secondly, and I think profoundly importantly, these are experiences about real people. It's not just a clinical doctor telling you what to do like WebMD, but it's an opportunity to meet people like you who've been there, who've experienced what you've experienced, and can give you not only support and guidance, but also to give you some ideas about how you live your life in a real-life basis, not merely the science, which is obviously incredibly important, but how do you really function on a day-to-day basis when you're thinking about or wrestling a health condition.
So these expert patients, where do you find them?
Every one of our sites are populated to begin in the content that we create with what we call expert patients. And these are folks that maybe you and I have never heard of before, but they really are true advocates and leaders within their conditions in specific areas. And we have spent years literally building this network of people who effectively start the conversation on our websites. Some of them are medical professionals, but most of them are just activists who have written books, or they've been on television, or they may have the #1 blog in, say, bipolar disorder or depression, and they come and they write for us to start these conversations, and then eventually other people participate as well.
Is there a danger in self-diagnosing?
There's an absolutely profound danger in self-diagnosing, and we would never want to be in that kind of environment. I think when you look in the offline world, whenever we're thinking about a health circumstance, there really are two resources that we rely on. We actually absolutely in the end rely on our medical professional because she or he will help us think about the science or the ramifications to our physical health. But as you know, or anyone knows who's been through that experience, you also rely, as you organize and aggregate your truth, on people who have been there. And you take these considerations, and at the end of the day, we're very clear on our sites that you have to talk to your doctors about anything having to do with science. But when you're looking for empathy, when you're looking for support, you know, very often that's not the first place where you go. You really want to go through people who've been there. So in many respects, they can help you think about the questions you want to ask your doctors in any event.
What kind of medical professionals do you have on staff?
So it's very important that we have a medical aspect because we do have a significant amount of content on our websites that do deal with clinical in nature. Very often what we do is partnerships like with Harvard Medical School to get good definitions and just basic background on what's going on in a health condition. We also have a doctor who's a former Stanford doctor who's our chief medical officer out on the West Coast who helps coordinate the quality of some of the networks that we build in that area. We also have medical professionals who are participating as participants or experts within our additional sites. If we ever have content that's generated by us, as opposed to content that might be generated by other people overall, that becomes clinical in nature, we have doctors who vet that, which, you know, by the way, is a great mechanism that most journalistic organizations don't even do.
Chris Schoeder, have you found through research that the first place now people are turning if they have a symptom or a concern, a health concern, perhaps is online?
There's absolutely no question that literally anyone who has access to a computer and specifically to broadband research from Pew and 100 other places will tell you 85 or 90% of them literally start online. And in fact, most of the time they start with search, Google or someone like that. And as you know, nobody Googles health. It is a tragic situation where maybe a family member has been diagnosed with a very serious disease, or maybe you've broken your knee running a marathon, or your kids have the sniffles. But you'll start going to multiple locations to aggregate your truth. This is why we thought this is the exact kind of behavior that people are doing right now that we could be responsive to by building these very condition-specific websites to allow that kind of engagement, knowing full well that people will go to multiple locations and go to multiple places to help get smart on what they want to do. But the whole essence of our hope here is that we are one of the significant vehicles where people can really take control of their lives and start taking their decision making in a very profound and important circumstance.
Why did you say especially broadband?
So broadband is changing, I think, the very fundamentals of the way people live. I have to tell you, I used to run all the online businesses for the Washington Post and Newsweek, and I've had a lot of different experiences about great single brands and then how things have moved and evolved in very different ways overall. And it's absolutely clear that when broadband becomes part of people's lives, that you assume it. It almost makes the internet and interchanges and communication like turning on a light switch at the end of the day, because it's just so simple and easy. And whether it is literally in your computer or on your wireless device, it becomes in a way a continuation of you, which means at the end of the day that you've got an ability almost anytime, anywhere to find or connect or communicate with anyone or anything that you want on your terms. And I think the ramifications in that in terms of people's ability to find information are significant in many ways.
Well, as you well know, this country is in the middle of a healthcare debate, a health insurance reform debate. What's the role that online would play in your view, in any reforms?
So it's very, very interesting to watch what a profound role technology played in the presidential campaign, which I think has been reported on in 100 different places and quite palpable by the evidence of the results. It's been very interesting for me to see that in governance, it hasn't played quite the central organizing principle that is done per se in the way that it did in politics. And my theory is that when you're running for office, your goal is quite clear. There's one very specific thing you're doing, going for one very specific deadline. But when you start getting into the nuance and the complexities of governance, of policy making and all, then all of a sudden you have very diffuse technology in a lot of people's hands. And what you have are a lot of different voices saying a lot of different things, which in the end have a ramification on the debate for sure. Because you can bet all the people who are very, very understandably worked up about healthcare reform are looking at Twitter and they're looking at Facebook and they're looking at different places to get part of their information. But it has not been a unifying organizing principle the way that it was in a national campaign. And it's going to be interesting to see whether that evolves over time in governance.
But when it comes to health, what's the role of online?
So more broadly, as opposed to the healthcare reform debate overall, look, the technology is, I think, one of the most profoundly important aspects to what's going to happen for people in healthcare on a going forward basis. We, in a lot of respects at HealthCentral.com, are sort of at the early vanguard of this, which is the ability for people to find on their terms information and people like them so that they can begin the process of taking control and decision making in their lives. And again, unlike when I was a kid, the ability for anyone to be able to do this at any time with great efficiency, but at the same time looking for trusted environments is profoundly important. So the information and knowledge aspect of it is the first stage of this, and it's very powerful. But as we start moving down the path where patient records can be literally shared and integrated in very, very powerful ways through institutions so that multiple doctors can have instant access and understanding of what you're wrestling so they can come to better conclusions for us as we go forward. As we think about the worlds where we can have monitoring devices, very permission-based, not in a way interfering, but while we're working out, literally keeping data records of how our heart is ticking and are things going to be problematic for us. All these are technologies that exist now. It is just the earliest part of what will change. And that's, by the way, before we start talking about changes in genetics and other parts of technology which will have huge ramifications.
A couple of questions from that answer. Is there a cost savings? Do you see a cost savings to healthcare costs by using the online portals such as HealthCentral.com?
So it's a lot of different ways to kind of answer that overall. Certainly the ability to aggregate very large audiences and serve them with highly reliable experiences is a fraction of the cost of how it was delivered in traditional means. So literally the comparison of, say, building a television show or putting out a newspaper, there's no comparison in terms of the cost differential there. And that allows, all of a sudden, a nascent startup company like mine 4 years ago to reach now over 11 million people in very, very short order, which would have been almost an impossibility except for an enormous cost to development if we had this conversation 10 or 15 years ago. In terms of costs in the experience, to the degree I believe that there are greater efficiencies and efficacies, to the degree that patients take more control of their health care, because I think if anything has been clear in this healthcare debate is that there's incredible onus on all of us, and anyone who's been through a healthcare experience knows that. There's incredible onus for us to step up and be our own advocates in health. The ability to have this kind of efficiency and ease, to be better prepared for your doctors, to be better prepared to take care of yourself in wellness-related situations, I have to believe over time will have very significant ramifications on cost.
What about, you talked also about emailing or medical records and electronic medical records. Pros and cons.
So it's a really interesting, complicated way, because to think about health records, there are maybe three issues you have to think about. The first thing to think about are the institutions themselves and the ability to have efficacy for your doctors or caregivers to be able to share information. And I think that it's very smart to think in terms about these places that actually have our data, that have our information, and the ramifications of it, because that's where a lot of the cost to deliver this will happen and where a lot of the benefits and care will come because of that. The second is about us as users. And this is the one that I think is very, very complicated, because at the end of the day, and this has been probably my biggest surprise being in healthcare over the last 5 years, is that so much has been beaten into our DNA in decision-making in healthcare is done by someone else. Your doctor tells you, of course, what you do as they should, but your employer may tell you what doctor you may go to. Your insurance company will help you prescribe what kind of services you'll take. And at the end of the day, we tend to worry about our copay, and if we have insurance, how much we're out of pocket every year. But I've never met, or very rarely met, anyone who's ever asked for or personally touched their patient health records, except to have them moved to another doctor. So what we're asking of you and me is an ability to engage in a behavior that we don't do. I mean, when you stop and think, it took 10 years for us to really adopt online banking, and it's still not all there. 10 years. And you and I have always banked. So there's this very interesting thing on the user side where they're going to have to be taught a new behavior and the benefits of this new behavior to participate in what they're doing going forward. Look, the third leg of the stool, which in a lot of respects is the stool itself that people worry so much about, of course, is privacy. And that's going to be the issue that can be the downside of any of this. I have to tell you that the technology is just so profound, and the people who are thinking about this, we're a partner with Microsoft and Google and some other people in thinking about some of these issues, so this is not an area we would go in ourselves. And you trust me, they don't go to bed at night without thinking about how to make sure this is the most secure environment. And I believe over time trust will be built into that, and frankly I think some younger audiences are a little bit less concerned about the privacy issues than others.
So you say the technology does exist and is widespread to protect privacy?
Well, the technology, to think in anything in technology that anything is bulletproof, of course, would be a mistake. Anyone knows we're spending time in technology knows that things can go wrong all the time. That's a risk of life. Quite frankly, when your credit card was being used, there's a risk that something could happen to you. I think at the end of the day, there's always going to be bad people out there who are going to try to figure out bad things to do, and all you can do is be highly, highly focused on it. And at the end of the day, the question is, does the benefits of what this offer outweigh the risks that are associated with it? And I think they profoundly outweigh them.
When people go to HealthCentral.com, do they have to register, and what kind of privacy do you have within your portals?
From a communications and a website perspective at HealthCentral.com, I think the watchword for everything is transparency. We never want people to be confused about what they're doing or where they are. If you see an encyclopedic article or an article from Harvard Medical School, you should know that's what it is. If our expert patients are telling you something, you should know what that is. If you're getting an advertisement for something, you should know it's an advertisement, and it can all be a part, again, of your aggregation of truth. So we're very, very clear about the lines and the conveyance of it. We do ask people to register for some of the tools and some very powerful email alerts that we put out going forward. But again, we're extremely transparent in terms of this is what we're doing with your data and this is the information that you'll have.
But when you look at your site, Mr. Schoeder, there are some pretty personal questions on that site. And are those people protected from asking their personal health questions?
So it's, again, I think the watchword is transparency, and as a corollary of transparency, you know, people have to make determinations how much they really want to share or do what it is that they want to do. Some people are incredibly open to describing what they have. And the good news about folks who are willing to talk about it very, very candidly is it brings a sense of authenticity, you know, and import to it in a way. But the fact of the matter is you can read a wonderful post by someone who's a little bit more reserved, has not necessarily identified themselves, and it still can be very profound just by the integrity of what it is that they're saying and the way that they convey it. One of the things that has been very interesting to watch, which surprised me a little bit initially here, but it shouldn't because it actually makes sense, is that so much of the activity when people are sharing stories or anecdotes or going forward, the lion's share of people, particularly if they've come to the site for the first time, really are kind of leaning back and treating conversations as content. They're not necessarily participating, they're not necessarily registering at first. And again, just talking and going through my own health experiences in my life, you know, in the early days of a diagnosis, you are just overwhelmed and confused, and you want to lean back. You want to sit back and watch and see what people are saying and then make a determination when you jump in. Every so often there are circumstances that happen online where people will register or put a comment down and they don't realize that they did it in a way that maybe Google could pick up on it in some form. But that happens very, very rarely now. We don't have an issue with that at all. So I think overarchingly, again, if everyone knows what they're doing and how they're doing it, you're in a pretty good place.
We are talking with Chris Schoeder. He is the CEO of HealthCentral.com, and this is the Communicators program. Mr. Schoeder, are you following Congress? Are you pleased with how Congress has treated the issue of technology and privacy?
I had a wonderful conversation with a great former Chief of Staff of Congress, and we were kind of lamenting about the level of dialogue about a host of issues in Congress right now. And we're both fairly well versed in history. As you look back, I think every year, every time in history, you'll find someone who really complains about the way Congress is thinking about things and worrying about election and not doing this kind of stuff. I think there are aspects of tonality today in all debates that sometimes seems a little bit more concerning than what I've seen for the most part over my lifetime. And that even falls into not just the healthcare debate, but you do see it sometimes in terms of technology and all, because some people are more comfortable with technology than others. Some people represent more technologically engaged people and businesses than others. And like most things in life, there can be a tremendous amount of fear and worry about this kind of stuff. I think when you slice all through it, there are some very core issues that are profound, things like privacy, things like transparency, things like open access, which are very important and that the government must and will play a role in, even if you didn't want it to overarchingly. And you just hope that in a process that can be kind of messy in building, that more often than not the right thing and the freedom of speech protections that are coming are supported in any technological initiative. And so far, they think they've been on the right side for the most part.
In your current business, how much regulation do you face?
Yeah, wonderful question. Like any internet company, any of the issues that are being thought through about broadband expansion or privacy issues or how folks can advertise in this new environment certainly can have some ramifications on the business side of what we have. We're not regulated and we don't have HIPAA issues with what we do from a health-related area. A lot of our advertisers and a lot of our partners are under very strict regulations from the FDA, appropriately so. And so we're very well, it's good to be in Washington. I mean, we're very well versed in these issues and we're sensitive to them and are constantly making sure that we're on the lines again. I think really at the end of the day, transparency again becomes a watchword, keeps you on the right side of the ledger of what you're trying to build.
You mentioned that you had been with the Washington Post, running their online
Washington
site.
Post and Newsweek,
Where else have you been?
So I ran WashingtonPostNewsweek.com. You know, I started, I think, just about the day the bubble exploded, 8 years ago or whenever it was, and ran that to profitability before I broke off and was an entrepreneur. I ran another fascinating company here in Washington that the Washington Post company had a big stake in called Legislate. And Legislate, in a lot of respects, was a great introduction to the internet because it was an online service, paid service, that gave you everything you want to know about legislation and regulation if you might be a law firm or an educational institution or a government affairs group and all. But just as I took the company over, the United States government put literally all their documentation online for free. And so I was the first, in some respects, of people realizing that if you can't think about a real unique proposition and are just relying on information in and of itself, that's not going to be a good place in this new technology. You have to have people get the right access to the information they want on their terms, and you have to give them some insight that they can't get anywhere else. Otherwise, you're not going to be able to function.
You were also with Launchbox?
So, yeah, a wonderful program here in town is called Launchbox Digital, and what they do is it's a group of other business executives here who help young, really startup people hone down and think about their business plans and then reward them with very small angel investments going forward. And I have to tell you, if there's any day that I come in feeling cynical about life or I feel a little bit down, watching these 20-something kids, without any reservation about anything, talking about exciting new worlds and how they can bring technology to bear in your lives, I get more out of it, I think, than they get out of me. It's a fabulous experience.
But there's a little bit of crossover there with Launchbox. One of the co-founders is Julius Genachowski of the FCC. Do you know him?
Oh, yeah, wonderful man.
And does it benefit you at all to be running a tech company and know the head of the FCC?
No. Look, I served in government also. I mean, I worked in the State Department and a White House, and so, I'm well trained to know that any public servant worth their salt knows exactly where the lines are. I haven't talked to Julius since even before he was Senate confirmed, and quite frankly, I'm not sure there's anything there that would benefit me, but I would never have that kind of conversation. And these guys know that everything has to be done in an absolutely, kind of linear way. If there are opportunities where, anyone or we could be helpful to government, of course I want to do it as a citizen, but it doesn't, it never even crossed my mind.
And you served in the first President Bush's administration,
Bush father.
Correct?
Yeah.
Does HealthCentral make money?
Yeah, so HealthCentral is fundamentally a media company. And so the very thesis that I articulated before is actually not only the way users are behaving, but I believe the way advertisers are advertising overall. If you and I had this conversation 15 or 20 years ago, generally if you were a media company, you wanted to reach as many people as you could possibly reach, and then you could figure out that somebody would throw money at you and you could make a business model out of it. But the beauty of the internet is twofold. I mean, one, it's just tremendously precise. People can find very targeted information on the terms that they want to find it overarchingly. And marketers can actually get the right message in front of the right people at the right time. And I actually think, done appropriately, that kills two very important birds. If you get an advertisement that's relevant to you, it's actually relevant to you. As long as you know it's an advertisement, it's part of your aggregation of truth. And obviously, if you're a marketer trying to reach audiences that are relevant to you, it's wonderful to actually do that as opposed to annoying people or spanning them or interrupting them or everything else. So the fact is that particularly in healthcare, a lot of folks in the marketing world really are trying to engage in a conversation or reach people that are particularly relevant to them. Sending me a spam or interrupting my TV show about something that has nothing to do with me is a waste of time. But I have to tell you, if I'm hit with a message which is relevant to my consideration at the time, I may or may not choose to engage in it, but at least it's relevant to me.
How many employees?
So we're a networked kind of a company. We have just under 100 employees with offices in New York. Washington, D.C. is our headquarters, Chicago, San Francisco, and we create some video out of Texas. But we have a network literally of hundreds, and now in some areas thousands of contributors and bloggers who are actively building the conversations and sharing the experiences, which I think are so valuable.
Being the kind of company you are, do you even need a central office?
It's a wonderful question, and different people will argue it differently from different perspectives of entrepreneurship. I think at the end of the day, there's incredible value in human touch. I think there's incredible value in a culture of an organization. And look, we have people who, quote unquote, telecommute. Our whole network of content creators, are effectively not in our offices, they're around the country. And it's wonderful, just have to engage with them and communicate with them. But when you can literally walk across a room and sit down with somebody and have a real conversation about an innovation or something that you want to try that you've never tried before, it's pretty hard to substitute the technology. There are wonderful technologies, particularly that we use between our West Coast offices and here in product development. We have a wiki like any company worth its salt does, where people are sharing and communicating with what's going on in the organization. But the physical touch still has value.
You started about 4 years ago. Where'd you get your startup capital?
So we put together a group of investors and people who were really kind of friends of mine, which has been very nice to work with very, very smart people. Because the money is not only very impressive about health and online generally speaking, but they're just good, honorable people who are trying to think about a different kind of an impact here. It started with a conversation with a wonderful man named Alan Spoon, who is an investor from Boston, who used to be the president of the Washington Post Company. So I've known him for many years, and in many respects, he incubated WashingtonPost.com and has had many experiences in that area. We brought together some great investors on the West Coast who had tremendous experience in places like Google and Yahoo, which just taught me a lot and had us think in very different areas, and some other people with some media experience overall. About a year ago, a very significant interactive company in New York called Interactive Corp put some investment in us also to help us do some acquisitions. So we're actually feeling pretty good about the money that we've raised, but I think as importantly, the quality of the people who are helping to help push us to think differently about this.
And some familiar names have also invested in HealthCentral. Barry Diller.
He's from Interactive Corp.
And Carlyle Group.
Carlyle Group is here in Washington, and they were actually invested out of their West Coast venture capital arm. And again, they bring in particular, some of these guys bring some great impact on media and internet. Carlisle's got some interesting experience in healthcare, which has been very educational for us.
And Chris Schoeder, just so I didn't miss the answer, I'm not sure what you said. If you said yes or no, are you making money today?
Yes, we are right now.
And 4 years ago, you started this company. If you started it today, is the same capital available to you?
Because of what's going on in the marketplace
Right.
overall? I think that there is, shall we say, greater wisdom and insight that investors are bringing to bear as they assess assets overall. I think the environment we have then, which is still pretty much the environment that we have now, which are not huge competitors in what arguably is one of the most important spaces online today, which is health. WebMD still is a great enterprise, and there's us and maybe one or two others of significant scale. I think a lot of investors would say if you're thinking about the world correctly and you've got a great technology and impact and configure a good path to build a business out of it, absolutely. But I think the standards have sharpened. It's very exciting. I know on the West Coast where some great innovation is happening in a lot of technology companies, their folks still getting funded quite regularly. But again, this is not a lot, there's not a lot of go, gee, isn't this cool kind of investing.
Well, what's the Washington area like for tech companies?
So it's interesting. You know, I think when AOL was here and some other folks grew to some sense of size a decade ago, we really were becoming a very interesting consumer-oriented community. That's changed a little bit, I think, in part with the shift of September 11th, where so much of the emphasis on technology today is homeland or security related in many parts. But having said that, it's a wonderful place to live. So there are a lot of great, young, innovative people here. And I've seen this in Launchbox, and I've seen it with my company and others. There's some fabulous early stage, and now in our case, medium stage companies that are growing, developing, and flourishing in the environment overall. Very often they'll be getting venture capital from some great venture capitalists here in Washington, or they'll be accessing money from other places overall.
So what's your advice to a startup company today?
A company or the startup entrepreneur?
Either one.
Itself? Yeah, it's a wonderful question overall. Look, I think there's a very fine line between the great ebullience that comes with thinking about creating a company and having some also sense of realism of what expectations you can build in the short term. I think that a lot of times entrepreneurs think of the exceptions as the rule. And so the number of times that I've had people either try to sell me a company at HealthCentral or have asked me to invest in a company and have said to me, you know, this is Google meets Facebook meets whatever, you know, instantly puts a yellow flag up in my head, not just from a business model perspective, but in that they're not thinking, you know, thoroughly about what are the ramifications of what they can build overall.
What do you mean?
So it's a belief that everything will be, you know, one level as an entrepreneur, you have to believe that you're going to build something that's unbelievably significant. But at the same time, if you're focused on the wrong analogy and are just doing it to build it for big sake, as opposed to thinking about the impact you're really making this asset on people's lives. Look, there have been unbelievable technological innovations, obviously, in the last 10 years. It's cliched, but it has never ceased to amaze me. The number of great innovations at the end of the day pass a very simple test, which is, does this service make my life better, easier, faster, cheaper, more beautiful, more efficient than the way I did it before? Every so often, something in technology profoundly changes our behavior. But if you look at what Apple has done, if you looked at what Microsoft has done, if you look what Google's done, it absolutely passed the criteria of doing something that's very profoundly useful in our lives, that you've just made it much more beautiful or much more efficient or much easier or much cheaper for me to do it.
Two final questions. Why healthcare for you?
So a couple of things about healthcare overall. I mean, firstly, I have to tell you, and this is what I would have told you in my news days, I'm very moved by finding ways to take advantage of these incredible technologies and skills that have impact on people's lives. It's the thing that I love most about the news business. I mean, I and my colleagues, both on the news end and on the internet, and I think all of us look back at September 11th as one of the, you know, profound moments at many levels, as we all did, but particularly because we were engaged in it and trying to get information out at a time where no one knew what was going on. And healthcare obviously is very much that area. Like everyone, I've had very profound health experiences in my family. And like everyone, when I was able to find people who've actually been through those experiences, the impact on me discovering how many things I was doing wrong, the impact on thinking differently about how I could be helpful or supportive, the impact for me to even resolve my own conflicts about those health conditions were very profound. And this technology just, it's almost as if it was created for health conversation. It's just such a profound thing, and it was a no-brainer really for me.
And finally, technology in the next 5 years and HealthCentral. How will different technology affect your website?
So technology in the next 5 years is almost an impossible question to ask. I mean, you need to think about it in terms of a year. It's almost a cliche to talk about the speed of this, but remember, I mean, what was YouTube 3 years ago? And it's completely revolutionized the way people are thinking about content, generally speaking, let alone the access over it overall. I think in our worlds, the one thing that we need to focus more on, and I think a lot of great startups are doing this right now, either as standalones or part of their experiences, and I'm not sure everyone fully understands the ramifications of it, but it is the idea that these handheld devices, which you and I once called telephones, are in fact full computing devices. They're absolutely broadband accessible now. They are actually computers, but with different sizes and different experiences that change the way that we communicate, that change the instantaneity by which we find each other, by which we find experiences. And there's no question that there will be enormous opportunity in health with the portability of information and engagement instantly that people will have wherever they go.
All right, I lied. One more question. What's your advice to Congress on healthcare reform?
This is, as we used to say, the government above my pay grade at one level. Look, I think as I look at healthcare reform, two fundamental things went sort of awry, and they were corollaries of themselves. Nature abhors a vacuum, And when things were not very clear about what the themes and the missions and the impacts were, it gets people very nervous. Where the corollary of that is that I found throughout my life is that if you're going to talk about change in someone's life, you've got to be able to articulate to them why the change, the cost of change, is less than the cost of staying the same. And I think that there was a profound opportunity missed to bring that sense of cohesion, even at the thematic level in this conversation. And so what ended up happening is you have multiple plans and a lot of tactics and this kind of stuff, which has made it very complicated. I don't think it's too late for that. I think some of the plans that we're seeing now in the President's speech last week did a lot of that in a very, very positive way. But I think these folks need to realize that this is something that will take time, that if you can have some good, quick wins and move the ball in the right way, and that you can be very transparent and honest with people about what you're doing and why and the ramifications of it are going to be hugely impactful.
HealthCentral is the company. HealthCentral.com is the website. Chris Schoeder is the CEO.
Thank you.